Bronchitis is a common respiratory condition. It affects millions worldwide. It occurs when the bronchial tubes become inflamed. This narrows the airways, making it hard to breathe. Bronchitis can be acute or chronic. Acute bronchitis is usually viral. It lasts for a few days or weeks. Chronic bronchitis is long-term and needs ongoing care. Proactive measures can reduce our risk. Acute bronchitis, often called a chest cold, has a sudden onset of symptoms. It is primarily caused by viral infections. Chronic bronchitis is more persistent. It involves a productive cough lasting at least 3 months a year for 2 consecutive years. Long-term exposure to irritants is the leading cause. Smoking is the most significant risk factor. Other irritants include air pollution, dust, and fumes. These irritants trigger inflammation and excess mucus production. Acute bronchitis is usually self-limiting, while chronic bronchitis requires ongoing management. Understanding these differences is crucial for seeking appropriate care. Certain individuals are more susceptible to developing bronchitis. People who smoke are at the highest risk, as smoking weakens the lungs' natural defenses and increases vulnerability to infections. Exposure to secondhand smoke also increases the risk of both acute and chronic bronchitis. Other risk factors include exposure to air pollution, fumes, and dust. People with weakened immune systems, such as infants, older adults, and those with chronic illnesses, are more susceptible to bronchitis-causing infections. Additionally, individuals with a history of allergies or asthma are more prone to developing bronchitis. Recognizing these risk factors can help individuals take appropriate measures to minimize their chances of developing this respiratory condition. Section 4. Diagnosis and treatment. Identifying and addressing bronchitis. Diagnosing bronchitis typically involves a physical examination and a review of the patient's medical history. Doctors will listen to the lungs for wheezing or crackling sounds, which indicate airway inflammation. In some cases, a chest X-ray may be ordered to rule out other conditions, such as pneumonia. Treatment for acute bronchitis focuses on relieving symptoms. Rest, fluids, and over-the-counter pain relievers can help alleviate discomfort. Antibiotics are not effective against viral infections, so they are not typically prescribed for acute bronchitis unless a bacterial infection is present. Treatment for chronic bronchitis focuses on managing symptoms and slowing the progression of the disease. This may include medications to open the airways, reduce inflammation, and thin mucus. Section 5. Prevention and precautions. Safeguarding your respiratory health. Preventing bronchitis involves adopting healthy habits that protect the respiratory system. Not smoking is the most critical step, as it significantly reduces the risk of both acute and chronic bronchitis. Frequent hand washing, especially during cold and flu season, can help prevent the spread of germs that cause respiratory infections. Avoiding close contact with people who are sick is also crucial. Getting vaccinated against the flu and pneumonia can further reduce the risk of developing bronchitis. Wearing a mask when exposed to dust, fumes, or other irritants can protect the airways. Maintaining a healthy lifestyle, including a balanced diet, regular exercise, and adequate sleep, strengthens the immune system and reduces the likelihood of infections. By following these preventive measures, we can significantly reduce our risk of developing bronchitis and maintain healthy lungs.